Get the insights of EpiMetrics co-founder and senior technical advisor, Dr. John Wong. Doc, thank you so much for joining us. Do you agree or disagree with Dr. Tony Liachon that this lifting of the face mask mandate indoors is premature?
I think it's better to think about this as layers of risk. No? So we have vaccination, we have ventilation, and if we can keep distancing, then removing face masks will be safe for people. No? So if you're outdoors, you're walking, you're jogging, it's okay not to wear a mask. No? But if you're outdoors in a concert, you're packed together, then it's safer to wear a mask. No? You also have to look at your own condition. No? If you're elderly, if you have a chronic disease, if you're immunocompromised, again, it's better to wear a mask. Still continue to wear a mask.
There are quite a lot of levels that you mentioned, Dr. Wong. How do you think will our kababayans understand this executive order when it is signed?
Well, the executive order says government will no longer enforce it. No?
Yeah.
It just says it's not mandatory. Pero it is not discouraging people to wear a mask if they think they need to wear one to protect themselves and to protect other people.
What about you, Dr.
Remember
Wong?
also that
What about you, Dr. Wong? Personally, you've been vaccinated and you have been boosted. How will you approach this personally?
Yeah, I'm vaccinated. I will continue to wear a mask indoors. No, actually, I even continue to wear a mask outdoors. No? Kasi indoors, I'm not sure whether the mall or the restaurant I go to is safe. No, so for example, when I teach, even if the room is air conditioned, I insist that the doors and windows are open.
I think many of us have really gotten used to wearing masks indoors and outdoors. But do you think that this is also the right time amid the local transmission of the more transmissible COVID-19 Omicron XBB subvariant and XBC variant?
Yeah, it's not the best time to do it. Because we're moving from the current variant to variants that are more transmissible. So with less people wearing masks, we should expect cases to go up. However, if you're vaccinated and boosted, you should still be able to prevent severe disease or death. So it's important to get vaccinated and boosted.
But our booster levels are still quite low. Dr. Wong, it looks like the government's first 100 days target has not even been reached.
Yeah, that's true. I think it's because people don't see the types of or the kinds of severity or deaths that we saw at Delta. So they see that the death rate is very low now. So they don't feel that they need it personally. But I think it's still important because even if you're not at risk, there is still some risk. Because we've seen that young people still do die of COVID.
Is the medical community, Dr. Wong, and the executive branch, you think on the same page? For me, from what I'm observing, the government seems to be seeing COVID-19 is in its endemic phase.
Well, I can't speak for the medical community, but I can see where government is coming from. There's the health sector, but there are also other important priorities, that like getting kids back to school, getting people back at work. So I think the question should be not whether we should do this or do that. I think the question should be how should we do these things safely.
And should we also do it safely by maybe ramping up or being more aggressive with testing?
Not testing. Testing is a very inefficient control measure. Kasi even right now, at our current rates of 2,000 a day, that's about, if you test about 1,000 people, you only find 3 cases. So it's very wasteful. The two most important things we need to do is to ramp up vaccination and boosting and have better enforcement for ventilation regulations. that's actually the key, no? Better ventilation indoors.
The business community is pushing the government to order the bivalent vaccines. How important is this? Plus the primary doses, plus the boosting in safeguarding and protecting lives and the economy as we enter the holiday season, Doctor?
The bivalent vaccine actually has value only for those at highest risk. No? So those who are immunocompromised or elderly, no? The immunity has waned, no? Even with 2 boosters. No? So they benefit most from the bivalent vaccine, but almost everybody else, no? Will gain very little from it.
But are the
that's
bivalent
why
vaccines more
even the
effective
big
against the new
sorry.
variants? Are the bivalent
Pardon?
vaccines more effective against the new variants?
If by new variants you mean XBB and XBC,
XBB and XBC, yes.
we don't know yet, no? because what is in the bivalent vaccine is the original variant, no, from 2020 and BA5, no. So it doesn't have XBB or XBC and has not been tested against them.
And finally, Doctor, on a scale of 1 to 10, how do you think that this administration is handling the pandemic response?
I think I would give it a 7 because cases and deaths are much lower, no, than over the past couple of years. No? But in terms of implementation, no, there's still a lot more that they can be doing. No? Aside from vaccination, no, enforcement of ventilation regulations.
EpiMetrics co-founder and senior technical advisor, Dr. John Wong, thank you so much for your insights.